Okay, hello everyone, and welcome to our Kuwaykib webinar, which is a medical students bioethics webinar series. We have with us today Mr. Anas Zouhbi. Um Anas graduated from the American University of Beirut with a BS in biology. He then joined the Faculty of Medicine, a BFM, and is currently a second-year medical student. His
On
interests
the other
center
hand,
around.
will not be.
Excuse me. Yes. His interests center around clinical medical research, bioethics, and access to health. He is very passionate about pursuing a career in research and has already published several papers on different topics: adolescent health and environmental impact, cardiac interventions, and outcomes of cardiomyopathies. With SHPPP, he serves as a committee member in the Medical Humanism Fund and as a researcher, with his work focusing on access to healthcare services in Lebanon and the MENA region. The inspiration behind his talk comes from his work with the SHPPP on forced migration and access to healthcare, where he discusses some of the latest updates on the status of refugees in the MENA region and the difficulties they face when it comes to accessing healthcare services. This topic for today will be forced migration and access to healthcare in the MENA. Go ahead, Anas. Thank you for being with us.
Thank you for the kind welcome and hello everyone. Welcome to this talk. It's my pleasure to be here. So my name is Anas El Zouhbi and I thank you for joining. Today I'll be talking about forced migration and access to healthcare with an emphasis on the MENA region. I look forward to this discussion and feel free to interrupt me at any time if you have any questions or any thoughts. Okay. So the outline of my presentation will be as follows. I will start off by introducing and defining the idea of forced migration. What does it mean? Who are the refugees? I'll also share some of the latest trends and statistics with regards to forced migration. I will then move on to some of the ethical and bioethical considerations with regards to access to healthcare for refugees. I will also address some of the health challenges and health burdens that these refugees face and how it may differ from the regular population within a host country. And finally, I will also share some of the recommendations and the current interventions that are currently in place, and some recommendations on what needs to be focused on in order to help solve the issue and improve access to healthcare for refugees. So before I begin, I wanted to share this quote from the Constitution of the World Health Organization. It says that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. So today in this talk, we will be taking things and focusing on things from the lens of the refugees, and we will see how things seem from their end. So to start off, forced migration, as defined by the International Organization for Migration and European Commission, is defined as a migratory movement which, although the drivers can be diverse, involves force, compulsion, or coercion. So this is obviously a broad definition which can be further subdivided and subclassified into different definitions based on the cause, such as conflict, economic burden, environmental impact, etc. Um, I also added a small figure here to just show some of the trends in the past decade or so, from 2011 until 2020, which shows a relatively significant increase in the number of refugees over the past 10 years. So this is highlighting just the importance of the issue and the importance of addressing the health concerns that arise because of this. So to start off, the refugees, as defined by the United Nations United Nations High Commissioner for Refugees, is are individuals who have fled war, violence, conflict, or persecution, and have crossed an international border to find safety in another country. So, as we can see, there are two main elements to define a refugee. One being the cause or the reason for the migration. So, in the case of refugees, it's war or conflict, and the other is the crossing of an international border. So, this is an important element that separates refugees from, for example, internally displaced individuals. So, these are individuals that have also been forced to migrate because of war or conflict. However, they remain within their country's borders and have not crossed international borders. So there are many types of refugees. So as we said, a refugee is an individual that has fled because of war or persecution. However, there are other terms that may fall under refugees. Asylum seekers are refugees who are not recognized by the fled country. Stateless individuals are individuals who are currently without any nationality and they do not belong to any country. So, and there are also other definitions like religious affiliation or political affiliation. Those are individuals that have fled the country because of religious discrimination, or in the case of political affiliation, political discrimination. So, as we said, this is an important, the idea of migration beyond international borders is an important distinction to separate it from those that have been internally displaced. So, though internally displaced persons are people who have had their homes badly destructed, however, they remain within their home country. Today, my main focus will be on refugees in general. I will not be going into detail behind the reasons of migration. I will be simply focusing on the concerns when it comes to access to healthcare and the concerns with regards to the health burdens that they face. However, I won't be diving in depth with regards to the reason of migration. This is just a quick summary to show the worldwide distribution of the refugees. As you can see in this table, I have organized it by country of origin, so where the refugees are from, and by host country as well. So where these refugees which country is hosting the highest number of refugees or migrants. And this table actually is specifically to refugees, sorry. Anyway, so as we can see, Syria is the country with the highest number of refugees, followed by Venezuela and Palestine. Now, Palestine has a bit of a more complicated definition since some Palestinians may be refugees within their own country. However, this number includes both those that have left Palestine and those that are still within Palestine. We also have Afghanistan and South Sudan. The host country with the highest number of refugees is Turkey, followed by Jordan, Uganda, Pakistan, and Lebanon. Now, I will also discuss Lebanon slightly because Lebanon seems to have the highest number of refugees per capita. So the previous table showed the highest number of refugees in general. However, when it comes to per capita, Lebanon is on top of that list. We currently have around 1.3 to 1.5 million refugees for a total population of 6.5 million in Lebanon. And the majority of refugees in Lebanon are currently either Syrian or Palestinian. To just talk about this point a bit more, so we have 64% of the refugees in Lebanon that make up around 866,000 that are Syrian, 480,000, around 35% are Palestinian. The remainder are distributed between Iraqis and Sudanese and other nationalities as well, which form a minority around 1%. So, access to healthcare. So we can see already that the issue of refugees is a serious one. And it is one that is affecting a large number of people, whether it is the refugees themselves, the general population within a host country, etc. Therefore, it is important to address the impact or the complications that this might have on access to healthcare. Now, with the increase in the number of refugees, there is obviously going to be a following increase in demand for healthcare services. And this would raise many concerns with regards to inequality of access. The healthcare system in any host country is going to have a limited number of resources. The so where are these resources going to be distributed when we have that increase in demand? Are issues like cost going to be a factor to be considered? Status of refugees, for example, those that have insurance, those that are from a certain nationality, etc. Language barriers or cultural barriers might serve an issue, and fear. So, what if refugees are new to a certain region? Are they afraid of seeking healthcare? Are they afraid of asking around? Maybe they lack the education, etc. We will be addressing all these factors shortly. And so many studies have already shown that there are major disparities that exist within the current healthcare system. And this has led and left refugees with limited education as to the rights that they have, limited access to healthcare, and as well limited care with regards to healthcare. So, some of the ethical concerns that arise. So as a lot of us already know, many refugees are living in camps. They live in congested areas. They seek urban places. So privacy and confidentiality can be difficult to maintain. This can pose as a serious issue. Some of them may be less reluctant to seek healthcare because of issues of privacy, and because of not being able to maintain the confidentiality that is required. Cultural and linguistic barriers, as we said, so it might be difficult for refugees to communicate with healthcare providers. It might also be difficult for them to ask around where they may potentially seek healthcare, or uh, maybe in even something as simple as communicating certain symptoms or certain answering certain questions. So this may also be add another barrier of difficulty with regards to reaching the proper diagnosis and receiving proper care. Finally, with the issue of informed consent, some of them may be illiterate, some of them may have a limited understanding of the process of the healthcare system within a country. They may be unable to make informed decisions, as we said earlier, some of them may be afraid, some of them may be suffering from mental illness. So all of these issues play a crucial role and pose some serious ethical concerns with regards to their access to healthcare. Other important factors to consider is regarding the issue of patient triage. So, this is the process of determining priority of treatment based on the severity of the patient's condition, their mortality or survival chances, and the available resources within a system. So, for example, two patients of a similar disease present, and let's say they both have equal survival chances. With the avail and we're only able to treat one. Who should be the person, or who should be the patient that receives the treatment? Are there any issues if the first patient is a refugee, if the second patient is a normal citizen within the country? Do these issues matter? We All of these need to be considered. Complications, again, when challenges arise with refugees. So some diseases may require follow-ups, multiple follow-ups, multiple lifelong treatment, etc. So how do these get covered as well? And finally, it's important to be just in allocation of resources and ensure that optimum quality is provided to all patients, regardless of their status, whether they are refugees, whether they are normal citizens, etc. So, as we said, there are some ethical concerns when it comes to resource allocation. Again, one example could be choosing between treating a large number of people with less serious conditions or treating a smaller number with more serious conditions, or priority to refugees versus priority to citizens. How do we make such decisions? How do the ethical principles of health help us in making these decisions? Again, just a kind reminder of some of the principles. We have autonomy, beneficence, non-maleficence, and justice in decision making. So it's important to be able to use and utilize all of these factors to make sure that we are being ethical and fair with regards to who is given treatment and who is provided with care. So I will now discuss some of the common health burdens that refugees are facing. So this is a nice figure that I found online, and it in a way summarizes into four major groups the important health concerns. I'll be talking about each of them briefly, but I thought it will make it a bit clearer to go over it in one slide. So again, there's the issue of poorly controlled chronic conditions or the non-communicable diseases like hypertension, diabetes, healing of injury, etc. Mental health is a major factor, depression, PTSD, maternity care and perinatal care, and of course the issue of communicable diseases. So I'll start by going over chronic illnesses. So as we already know, many chronic illnesses or non-communicable diseases may be asymptomatic for a while. They may not present with acute symptoms, and they may go on for a while without the patient knowing that they may have the disease. And a lot of them do require long-term treatment. They require long-term care and making sure that the patient keeps up with multiple medications. And studies have already shown that there are major differences in the impact that these diseases have on refugees when it co- and when sorry, many of them have shown that these diseases have a major impact on refugees, especially when compared to the impact that they have on the general population. Now, of course, some lifestyle modifications that refugees take part in play a significant role. For example, studies have shown that refugees are more likely to smoke, and that would also increase the likelihood or the prevalence of non-communicable diseases like hypertension or maybe diabetes, etc. With regards to perinatal health, this systematic review has showed that perinatal outcomes were predominantly worse among migrant women. They also suffered from worse mental health, maternal mortality, preterm birth, and congenital anomalies within the babies as well. And there are major complex obstetric issues that arise, sexual assault, offspring mortality, etc. So overall, there is a um, refugees are have evidence has shown that refugees are suffering from a larger burden with regards to health, and they also seem to have um, these issues have also been being passed on to the offspring as well. Mental health is another big one. Mental health is a serious problem with among refugees. Many of them suffer because so this table is nicely summarized. It divides it into adult and child. Adults seem to be suffering from mental health issues for various reasons, some of which are economic, others are disruption of social networks. So not all refugees end up in the same place. Not all of them are forced to migrate. So this disruption or sudden disruption of social support or social networks may leave them suffering from serious mental illnesses. trauma that they had to experience, whether it was from the initial reason of being forced to migrate or during the process of migration itself, plays a major role. Also, political involvement, as we touched upon earlier. Children also suffer mentally from many different things, including disruption of their education, separation from their families, and so on and so forth. Communicable diseases, so infectious diseases. So studies in Europe have suggest that infectious disease prevalence among populations of refugee and asylum seekers these populations most commonly suffer from tuberculosis and hepatitis B. Imposed risk can be attributed to poor living conditions during and after migration. So this also there's also the issue of vaccination. So the refugees also seem to be last in line for COVID-19 vaccines. The priority was given to regular citizens before refugees, and there were a number of factors that were attributed to this, and these are some of the thoughts that have been mentioned in the article. So, and they tried to interview the refugees to see what they thought the issues were. And some of them attributed to language barriers, others attributed to stigmatizing of the refugees. Some refer to reasons of fear. Again, the reasons behind this are not very clear. However, there was some discrepancy between when it came to the distribution of vaccines for COVID-19, and the refugees were at the bottom of the priority list. Children of refugees also face serious issues. They face issues with regards to a number of things, including their growth and development. They may have some learning difficulties, problems with oral health, vaccination, their nutrition, mental health, as we mentioned earlier. So, again, we can see that these wide range of conditions are affecting refugees in a number of ways, and their current lifestyle, the experiences that they have to go through, all have led to a worsening health outcome and a sort of deteriorating, uh, I like a deteriorating health burden. Sorry, a deteriorating health issue for them. Now, these are some of the organizations and societies that have allocated their resources or some of their resources to help support children of refugees. With regards to our region, the most important ones would be the UNICEF, United Nations Children's Fund, the United Nations Commissioner for Refugees, and the World Health Organization. They have allocated funds for research, for financial support, and for even action plans and policies to help support refugee children and refugees in general as well. So we saw that the health burden that refugees face is a major one. Now, what might be some of the recommendations that can be put to help lower this burden or improve the current status that they're in? One would be to help train and educate healthcare providers on some of the common cultural competencies. So within a host country, for example, there would be a high number of a certain culture of refugees that would be present. It would be a good idea to train and educate healthcare providers on the current cultures within the country, to maybe hire some people that are able to translate within healthcare systems to help convey messages or concerns of refugees. It'll also allow healthcare providers to become more aware of the different beliefs. So different cultures would mean different beliefs. Not all cultures are not all cultures believe in the in following the same health protocols. So it would be important to make sure that healthcare providers are well caught up and well educated with regards to the refugees in their region. It's also on the other end of the spectrum, providing refugees with information. So it's important to educate both the providers and the refugees. So let refugees know where they may be potentially able to access healthcare services, and some of the possible groups that may be able to support them financially if they are suffering from financial burdens. This also helps reduce the confusion that refugees are facing, and also the help control the fear that they have of accessing healthcare services maybe in an unknown region. And finally, an important one would be to promote sponsors, encourage donations, and support NGOs that provide financial assistance to refugees. So, all of these point towards addressing the issues that we mentioned earlier. The refugees face a number of issues, such as cultural differences, language barriers, and mostly financial difficulties as well. So it would be important to tackle these one by one to help narrow down the discrepancy that exists, or to narrow down the burden that they have, so that they are able to better access healthcare services and be more informed about the services that are available to them. And so what is currently being done? This is a nice summary that I found. It's a systematic review of some of the most common interventional approaches that are currently taking place. Again, as I discussed before, this article summarized or grouped the current interventions into four big categories, two of which include upskilling and educating, and it focuses on upskilling refugees and educating refugees on the rights that they have, the important services that they can access, and upskilling and informing primary healthcare providers that on how to approach refugees, how to approach the cultural differences that exist, and how to be better prepared to handle refugees as opposed to the general population that they're used to handling. It also focuses on another intervention that's being done, sorry, is system or service integration. So this focuses on improving the current integration models that are used and the structures of the healthcare system. And finally, an important one is enhancing communication. So this can be done through hiring translators at hospitals that may help convey concerns or symptoms of refugees who are unable to properly describe them, or in general, just enhancing the communication between the healthcare system and the refugees to better inform them of the possibilities that they have. And finally, before I conclude, I wanted to talk about the universal health coverage. So this is based on the World Health Organization Constitution in 1948. The goal is that all people should have access to the full range of quality health services that they need, when they need it and where they need it, without financial hardship. So the approach that they're taking in more developed countries or more developed healthcare systems is to focus on public health measures. So these are health systems that have and that already have the infrastructure that they need. They have the resources, and they are well developed in terms of their organization. However, so the focus here would be on policies to support, maintain, and improve their systems, as well as maybe educating and spreading awareness. However, in less developed or more fragile healthcare systems, the goal would be to fill in the gaps, provide technical support and infrastructural development that they lack or that would be present in an otherwise developed healthcare system, as well as providing them with the financial assistance that they need to to reach the goal of providing quality healthcare services to all. So the idea behind this is to just ma- reduce the discrepancy that exists between more developed healthcare systems and less developed systems, as well as providing um, all individuals within a region with the proper quality of healthcare that they deserve, regardless of their status or of their financial hardships. So that would be all from my end. I tried to be brief and concise to allow you to allow for questions and discussion. So please feel free to ask me any question or to share any thoughts that you might have. Thank you.
Thank you, Anas. Excellent talk.
Thank you, Anas. This was great. Uh, well done. Uh,
My
do we
pleasure.
have any questions, please? If you have any questions, you can simply unmute yourselves or write in the chat box.
The messages already say it's impressive.
Thank you for the kind words.
Um, I think I may have a question. I will see. Thank you, Anas, for the talk and for all your efforts as well. يعني ما بعرف how you make the time for all of these initiatives. يعطيك العافية.
Thank you.
I was just wondering when it comes to these interventions and what is required of host countries with regards to the health coverage for refugees. Um, what, but what about like in the context of countries that already are facing, as you know now, the economic situation and everywhere is is really dire. However, in let's say, and for the example of Lebanon, where we have an already crumbling economy, um, what would host countries, I mean, be required to do or be able to do with their already limited resources, or are they required to handle this all by themselves, or is there some somebody who, I mean, the international community, do they bear a responsibility to support and help host countries to be able to achieve all of these goals?
Mm. Yeah, so that's a great question. So of course, the World Health Organization is always communicating closely with governments of these countries that are hosting a high number of refugees. Now, in the case of Lebanon, you're right. We do have a crumbling system. We have a system that is suffering at the moment. It's important for us to be able to address our issues as well as those of the refugees, because the issue of the refugees is sort of placing another added layer of stress on our current healthcare system. So it's so how do I say this? It would be ideally you would want to start off by having a proper system that would first make sure to have proper surveillance and proper statistical or some sort of quantitative values of the situation in Lebanon. So how many refugees are here? What are their requirements? What services are they seeking? And what services the citizens are seeking and try to sort of distribute the little funds that we have in a way that is just and in a way that kind of helps ensure that no one is taking advantage over another. But yeah, like the World Health Organization does communicate like closely with a lot of the host countries. We saw that example also with the COVID-19 vaccinations. So they were always communicating with the host countries. They were providing financial support. There's also the 2030 goal of making sure all individuals are vaccinated. So there is financial support and close communication. However, with Lebanon, the issue is obviously a bit more complex given the political and the economic crises that we're facing. I don't know if I answered your question, but it's a bit like a gray zone over here.
Thank you, Anas. La, you're right that I mean Lebanon is a special
Yeah.
case these days. I appreciate your answer. So,
Thank you.
إذا حدا تاني has any question, please go ahead.
I think we can conclude, right, Tala?
Just with questions.
If there are no questions in the chat, all is clear.
Yeah.
Okay. Thank you very much, Anas. Thank you,
Pleasure.
Diana and Tala as well, and everyone.
Thank you, Anna.
Thank you so much for having me. It was a pleasure.